So, in reference to football injuries, when players, parents, coaches come in, the um, the question is, what's the worst that can happen if you leave this alone? And you have to realize that the answer to that question, regardless of the injury, is highly speculative because everyone's different. Every injury is different. We can speculate. We kind of know what's not so bad, horrific to the other extreme, totally horrific injury. But it's kind of like the question that comes up is, okay, what's the worst that can happen if we just leave this alone? And ultimately, always the answer is, you can have a permanent deficit of some sort. Now, exactly knowing what that deficit is, because you have to realize it's not just, x-rays can look pretty bad and people still kind of get along, okay. Usually we're dealing with people that are younger in age. And so when you have these injuries, particularly that affect the joints, and say the joints of the fingers, the wrist, the elbow, shoulder, any of these joints, major joints, smaller joints, anything that's kind of intra-articular or meaning involving the joint, um, has the potential of developing arthritis down the road. If you have a ligament injury and persistent instability, meaning that the joint's kind of loose a little bit, that can lead to arthritis. But sometimes that arthritis takes 20 years to develop. So a player who has a contract or a scholarship, they may look at that and say, well, in 20 years, I'll deal with it. It's one of those things. I see people at the other end of that. They've had these football injuries, and 20 years later, we're dealing with the arthritis, and it's not a fun story. So you have to consider that. But that's definitely one of the questions that I get, which is difficult to answer, and really, in truth, cannot be thoroughly answered because that would be, I have a crystal ball, and I can kind of know what's going to happen. So that's the case.